EGM Network.
Honestly, without Treasure Coast Community Health, I think we'd be a much poorer community in terms of our health. We're always striving to fill the gap for everyone in the community, rich or poor.
To share information in a conversational way about people and places and agencies around the community that make us the special place that I believe we are. After some 20 years, I can't imagine living anywhere else, and I'm sure many of you feel the same with an even longer or shorter period of time. So I have one of my good friends here today. Peggy and I have done a number of things together. Peggy is the leader of the Alzheimer and Parkinson's Association, and they are a nonprofit that relies strictly on philanthropic donations. But that's not why we're talking today. Not exactly. Although I'm sure she'll tell you where the website is and how to donate and some of the things you'd like to get behind.
Absolutely. We love to tell everybody about who we are. You know, so many years ago, nobody knew who we were. We didn't have programs. We didn't have money. And it's just been so much fun building a board and building your programs. And so for your audience, we are very local, very, what's the term? Grassroots organization for Indian River County, not related to any other we're not related to any national organization. And our goal, our mission is to improve the quality of life for families who are trying to manage the care of someone with dementia, which is 3 times harder than any other type of caregiving. And also on the other side of the community that we're helping, those who have movement disorders like Parkinson's, helping them and their families to achieve the best quality of life. And we do these things through support programs, through education programs, and through movement programs. And it's been so much fun. We're unique. We have grown organically. And so we now have about 50 programs. Everything is free of charge. 50. Wow. Everything is free of charge. So that's amazing. That is absolutely amazing. It is amazing. And the reason we do that is because our programs, while essential, they're also elective. And a caregiver is going to balk at crossing a threshold if it's going to cost them money. Absolutely. So that much needed help, that connection, that relief. The relief, the ability. One of our programs, Social Respite, it's activities from 9 to 3 every day for those who have dementia, as long as they are physically independent. We aren't in adult daycare. We don't have that massive, wonderful coverage that the Senior Resource Association has, where they can take care of a lot of medical needs as well. This is strictly activities, and it's one of the reasons we can do that for free. And it engages them, but the caregiver gets the day off for free. And it's so necessary. I was thinking about that as I was driving over to the studio and how things have changed. You know, when I was growing up and as a young woman, you know, the big C was something that was all consuming and entirely changed your whole focus. But nobody talked about, in a negative way or any way, about grandma that was, you know, knitting over in the corner, who was antisocial because her world had collapsed in. Correct. We didn't even call it dementia then. No. Okay. They didn't have a name for it. Exactly. And it was just, that's grandma. She's fine. Right. You know, touched. You know. Yeah. Exactly. And yet so much has changed as the years have gone on. Thankfully, we've gotten better at preventative issues relative to cancers and other diseases, but you know, the reality is we're still in an exploratory stage, years and years later, of what's causing Alzheimer's, what's causing the dementia, what's causing the Parkinson's. You know, there's a lot of theories, there are a lot of treatments, but you know, how do people live in families day to day with this kind of event in their family? And it's not just
one out of 100.
No.
You know, there are
Right.
many of us.
Right. In
that
Indian
are
River
now
County,
affected.
the statistic is almost 7,000
Wow.
just for dementia. And so, and the other thing to look at too is society, how we live has changed. So we aren't necessarily able to take care of our generations. You know, in most households, you've got 2 working parents and
Exactly.
children that need childcare, and trying to take care of mom and dad, and one of them might have dementia. They may live far away. That's a huge problem here in Vero. Everybody's retired here.
Yeah.
The
But
kids
the
are up
families-
there.
yep.
Exactly. And so and if a senior, this is an interesting statistic. A senior who is trying to take care of a spouse with dementia, 65% of the time, compared to 2 healthy seniors, that caregiver will predecease the one with dementia. 65%
Wow.
because of stress,
I can believe it.
because of the stress. And so what
If
we're seeing,
you haven't walked in those shoes, it's hard to imagine the stress because, well, you're at home and you love them, and so what's the problem?
exactly. And then all of a sudden they are becoming somebody that you didn't know.
Yes.
And all of the ways that you related, the way we build our relationships, we use logic and reasoning, and we can talk back and forth, and we're oriented to time and place and person, and we use our memory, and we use our language, and we have self-awareness. Those things are pixeling away and
Unpredictably at that.
Yes, and you don't know, and sometimes the behavior will be very out there. Some dementias are very known for certain aggressive behaviors, and so when they're trying to manage life, which life isn't easy. I don't know if it's supposed to be, but it's not. And so and then you put this on top, and they don't have the education, they don't have the support, and by the time they walk across our threshold, their hair's on fire.
I'll bet it is.
And so, you know, they need a place immediately where if they have dementia and they're coming to a program, they have to feel safe. And it's, oh, you look great. Come on, they're waiting for you back here.
And I have to say, Peggy, you are a natural leader for that, because not only are you a great educator in things that you just gave us as information,
Right.
okay? But I have been at some of your sessions where you've talked to Rotary clubs or other places of small groups of people where you help us with coping mechanisms, okay, so that our hair doesn't stand up immediately because of the 3rd or 5th or 27th time, 10 minutes after breakfast, they say, so when are we going to have breakfast?
Right. And
Which
then,
happens.
or I can't even go to the bathroom. He's right there. He has to be right there. You know, and this is, and really it comes down to changing perspective.
Yeah.
It comes down to making sure that you keep things simple. That life has got, as you just said a few minutes ago, it gets smaller and smaller and simpler, and processing is difficult and might make them lash out.
Yes.
And what you need is to connect with others. You need information, and you need to know that you're not the only one. You know, deniability is pretty easy to fall into, and you don't think anybody else is going to know. And I always love the question, well, when should we tell others? They know. They know. They know. And so, and the other thing is, let's educate your neighbors. Let's educate your friends so they can help you. You know, there are ways they can help.
Oh, but there's that shame factor, like it could have been prevented, or I'm inadequate, or
Right.
I don't want to burden them.
They'll treat me differently.
Exactly.
Yeah. And Parkinson's, folks with Parkinson's have that same reaction often because they feel like they've lost their power.
Oh, absolutely.
And actually, there's so many ways to gain their power with Parkinson's. And it's just, your life is different. You have a new job when you have Parkinson's, and that is to make sure you're keeping up and exercising and making sure you're getting the best medical care, and making sure that your caregiver, your spouse, your family is watching out for your outlook, because that matters. And you can add years on to the better qualities of your life. I remember one of our board chairs was told by University of Florida, because he was such a good advocate for himself, he put his symptoms on hold or stalled them by 5 years.
Wow.
So that's an amazing statement. that if you have exercise programs, if you have camaraderie, if you can laugh,
Yeah.
it is, that makes so much of a difference. If you can laugh and get your way through, but keep going. And,
That's so true. I had an aunt that lived with us while my mom was in hospice at our home. And she had, like you, she had the best outlook in life in terms of laugh it off, tease it back. Okay, don't make it the end of the world, because it's not. Okay.
We have a lady in one of our support groups, and her husband is in memory care, and she goes in every day, and she's got red hair, and he points to anybody else who has red hair, and when she comes up, he can't quite define who she is, but he knows her, and he says, "Oh, that's my wife," and he's pointing to one of the nurses, let's say, with red hair, and she goes, "Oh, she's beautiful. Job well done. And she just
goes with the flow.
It's like improv, but you just keep it shallow, and you keep it going, and you keep it lightweight, and don't reason.
Yeah, and that is what we all try to do as adults, out of habit or choice or somewhere in between.
I know.
It's learning those different coping techniques and then practicing them. And I have to say, as a redhead, I have the temper that goes with it, and I fought it my whole life. And so my secret now, if it looks like I'm not responding or paying attention, is because I'm saying, they don't know. I don't know. They don't know. I don't know. Instead of saying, what? We all have to try different things.
We do. We do. So, there's little tricks all along the way.
Yeah, and what works for one doesn't work for others, but, we got to try them all.
I know.
So speaking of trying something, we're going to try taking a short break for a word from our sponsors. Stay with us. We'll be right back. Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
Create your island paradise at Sunshine Furniture during our winter sale event. Save 50% on all Tommy Bahama and Lexington, including the newest collection, Key Biscayne. Living room, dining room, occasional chairs, office, and media furniture with sophisticated design and a mix of coastal and Caribbean style. All Tommy Bahama and Lexington offer everything you need for your Florida living. We have the largest selection of in-stock coastal furniture from Four Seasons, Capri, Universal, Riverside, Hooker, Sea Winds, Barca Lounger, Best, and lots more. At Sunshine Furniture, we're the outdoor furniture experts specializing in patio sets that withstand the Florida elements, and we have a gallery of Berlin Garden and Pollywood. Come in now for the best prices of the year. Sunshine Furniture, $12.95 US 1 in Vero Beach. Don't miss the 50% off winter sale on Tommy Bahama and Lexington going on now. Visit our website at sunshinefurniturecasual.com and visit our outlet store directly across the street.
It's the longest-running seafood festival in the Southeast, the Grant Seafood Festival. 2 days of live music and seafood to make your taste buds dance. March 1st and 2nd, over 150 crafters. Admission and parking are free. As always, the Grant Seafood Festival is 100% volunteer run. All proceeds benefit the Grant community. The Grant Seafood Festival, March 1st and 2nd. Powered by Gary Yeomans Ford Palm Bay. Maps and details at grantseafoodfestival.com.
And welcome back to Community Conversations. Those of you that know me or were part of our original conversation that started some 10 minutes ago, know that I am the CEO of Treasure Coast Community Health. And I do this community conversation because I have so many great friends and nonprofit partners, and some for-profit partners for that matter, that collaborate with us to optimize the healthcare of everyone in our community. And it can be mental health, it can be physical health, it can be just enjoying the outdoors, and then you get all of those benefits. Today I have Peggy with me from the... Is that one of the words that you mess up as you're getting dementia? Peggy Cunningham is from the Alzheimer and Parkinson's Association. Yeah. Yeah. Thanks. Thanks for the salt.
I know that one.
we spend a lot of time laughing, and that really is the secret to a lot of coping mechanisms that your organization helps with in the 50 programs that you have now.
I know.
And you brought a lot of cue cards, so I'm going to skip all of those and just say, talk about the most recent ones, because we have you on about once a year.
Right.
So what have you added to the pro forma here?
Well, we just added Tango for Parkinson's.
Wow.
So, yes.
I want tango anyways.
And then come. The gentleman who is teaching it has had Parkinson's for maybe 15 years.
Wow.
And so he teaches it. And what it does, tango is one of the best exercises for Parkinson's because you're moving forward, you're moving backward, you're cueing each other. There's beat. There's gait, there's balance, and then there's the music. And so it's fascinating. It's fascinating.
Sounds like it.
And we all get to be, we trained.
I was going to say, are you the partners sometimes?
Yes, sometimes. Yeah. I have found out that is not one of my skills. But at any rate.
I could polka.
Right.
Maybe I could
There
tango.
you go.
I don't know.
At any rate, we have that. We have boxing for Parkinson's as well, which is another fabulous program for Parkinson's. The benefits are just amazing, and it's very engaging, and it's empowering. You're not boxing with each other.
I was going to say, I'm really trying to vision that inside of your office.
Right. Aggressive day. No, it's stationed, so it's a circuit, and the woman who teaches it is certified by a program that is called Rocksteady Boxing, and so we have a bunch of different stations that they go around.
That is so cool because you can't do these at home.
No, and this is fabulous. Those are pretty much the only two of the exercise programs that you cannot sit down in them. But
you still have your singing program?
Oh, we still have the singing program, Tremble Clefs, that helps the voice and the facial muscles for Parkinson's.
And it's just a lot of fun.
Yeah. Oh my gosh, yes. And one of the things you were talking about when you were talking about is it aging? Is it is it what do I worry about? We have a program. We have a class called Total Memory Workout, and it's for those who have their cognitive ability, and it teaches you the mindful ways that you can increase and maintain your memory.
Because we are all aging.
Yes, we are.
I keep putting a brick on my head. It doesn't work.
It didn't work.
It didn't work.
Right. I just
look in the mirror and it's like, oh.
Fine wine, right?
Yeah.
Fine wine. But yeah, so that's one of the things that we want to make sure everybody is really well educated. That's what we're really finding is education is key. That way, if your neighbor needs something, you know how to handle them, you know how to help them, you know where to refer them. And, and then we connect with all these other facilities since we're not medical, but we are basically the emotional educational support that everybody needs for these. And we can't make it any shorter for you, but we try to make it better. And
you definitely do.
It's
so I'm sorry to interrupt, but I'm so excited about the memory piece of it. That sounds so preventative as opposed to you're already in the midst of a decline. Right. And how do you turn that around or at least stabilize it? Right. So you're talking with people who have not been to the neurologist and gotten a diagnosis.
No, this is for all of us.
Total what date and time? What date and time?
Yes,
I'll be there.
This is actually one of our most popular. We'll get 70 people at a time coming to this. Wow. And there's all different little mechanisms. They don't let me teach it anymore.
You can't remember how? I'm kidding.
But there's all little mechanisms for that. And then the other thing for memory when people start to worry is we give memory screenings. And everybody over the age of 50 should have a memory screening. Get a baseline. And it's not scary. You think it is, but it's really not. And then it basically evaluates different cognitive abilities, delayed recall, vision. There's all kinds of
And they're free. You said everything is free.
we do is free of charge.
Can't beat that.
I know. That's why.
Except reading the results. That could be scary.
So, the results, I know it would be scary, but basically what it does is it gives you a sense. And it's a decent range for the normal, so you don't have to worry too much. Okay. But it also gets the conversation started. If you think somebody, like let's say you think your spouse, you come in, both of you, each of you have your separate memory screens. It starts the conversation. And sometimes that's what needs to be done. Start the conversation. Why don't you check it out with a neurologist? That's where you're going to get some good information and we start from there.
And I can imagine some of the guys saying, "See, Maude, I told you were upsetting our children for no good reason. I'm fine."
Yeah, exactly.
But that's okay, too.
I'm sure there's a little competition as they're walking out the door.
That's right.
How'd you do? I'm not going to tell you.
Sure. But you're right. It's the not knowing sometimes that preys on our mind as well.
Yeah.
Is this the norm? Am I going to heck in a handbasket?
You got it. And really, what it comes down to is all of these things come down to what's your attitude, how are you gonna face these things, how are you gonna manage these things.
Easier said than done.
Easier said than done. That's one of the things for our luncheon, this successful aging luncheon. We got Jane Pauley this year, but we bring in people who are talking about how have they aged, what have they learned. It all comes down to what you've learned. This is, what you have learned that's what life is, in my opinion. And everything's a lesson. Every challenge is a lesson. And so if we can get the benefits of Jane Pauley and all she's gone through in life, and Jane Seymour we had, and we've had Scott Hamilton, all of these folks who have been through
tough times.
And and you dig down and you find out, okay, what do I need? Well, it's going to be perspective. That's what it's going to be. It's going to be perspective and some vigilance on your own self,
Because life is not a dress rehearsal.
No, it's not.
It's a one-time opportunity.
This is the one. So
when is your luncheon coming up?
So our luncheon is April 9th. Okay. And we have Jane Pauley speaking. And we are going to have Faith Daniels, who worked with Jane Pauley, was also a newscaster, and it's going to be a Q&A format. So she'll moderate that.
That's very different.
We'll have an auction with some trips. We've got a trip to England. We've got a trip to Italy. We've got a California experience.
And tickets are on sale now?
They will be on sale as soon as they're printed.
Sorry.
So this is,
I don't want to miss out. I usually miss out.
I know. It's going to sell out. So
yeah.
It's and it's going to be at the Vero Beach Museum again this year. And we have a paddle raiser, which is pure gold for us. And just,
it's so important because, as you say, that's how you make your services available.
This is how you do it.
Yeah,
exactly.
Because it is an uphill battle trying to convince stressed caregivers that now for them to get some mental health, they got to have financial stress.
Exactly. And that's one of the reasons we're hoping. Yeah. And we're moving within our building, but so we'll have a consolidated 10,000 square feet. And, again, that's where the funds they go so that we can be all together. It gives us more program space, more office space. And, it's just, we are seeing more and more. There's such a need. We served 3,500 individuals last year, but they crossed our threshold 14,000 times.
Wow.
So,
and the silver tsunami continues. So if you're interested in helping make life better for individuals, please go on their website, give Peggy a call. I might see you over there. And thank you so much for coming on again.
Thank you for having me.
You do such wonderful work. And I know you have a team of volunteers.
Yes, I do.
Call still open for that? If people
always
want to.
Volunteers for our classes and for teaching our dementia experience that we put you through. So yeah,
wonderful.
Lots of things.
Well, thanks for being with us to the very end. I hope that this has been helpful to you. It's been a hoot for me, as it always is, and I hope you share this information with your friends and family members because it just continues to improve our community. And I'll see you next week. Bye-bye.